Our presentation is going to be on healthcare in Sweden. So private and government insurance in Sweden versus the United States actually varies pretty drastically. Private insurance in Sweden is much less common, only about 1 in 10 people have it. Sweden also has some of the best healthcare in the world, and while the cost and quality is really good, they can have a longer wait time than the United States. It can be up to 90 days for surgeries and consultations with specialists. The United States has more Americans with private insurance, and only about 35% of Americans have public insurance. They also have one of the worst outcomes and spending when it comes to healthcare, even though they spend probably one of the highest numbers. So access to health insurance in Sweden and the United States. So in Sweden, health insurance is universal and decentralized, which basically means that everyone has access to healthcare, and each county or area basically has like a different official running the healthcare in that local area. The United States does not have universal health insurance, and that leaves about 8.5% of people without insurance. They do, however, have public and private insurance, the public being Medicare and Medicaid. Cost. So cost varies very drastically between Sweden and the United States. Sweden does not have free healthcare, but it's very inexpensive. They put caps on the amount of money that each patient or each person spends on healthcare per year. So the cap for things like lab work and x-rays and stuff like that have limits of $100 per year, and things like pharmaceuticals will have limits of $230 per year. Most of the money that the healthcare is funded by in Sweden comes from regional and municipal taxes, and plus anyone under the age of 20 has free healthcare. In the United States, America actually spends the most money on each individual person. I believe it's about $8,000 per person, making it very expensive. Things such as lab work can cost you between $100 and $2,000, depending on the kind of insurance you have and if you have insurance. Pharmaceuticals are extremely expensive also, depending on what brand you buy. The brand name can actually run the price up to 3.4% more. Funding from healthcare in the United States usually comes from out-of-pocket when you have private insurance, and public funding comes from federal taxes.
So in Sweden, they have universal healthcare basically for their citizens, meaning all citizens are covered, although it's not illegal if they do not have health coverage. In the United States, insurance is optional. You're able to pay for like private insurance, or you can get it through the government if you qualify for those Medicare, Medicaid. Although being in the US, if you don't have insurance, it tends to be much more expensive and more money coming out of your pocket during that time. All of the services, so like surgeries and specialists, are covered through your insurance in Sweden. Although they do not have emergency departments, they're not really open as much, so most of the people have primary care providers, and they have to offer after-hour care. Yeah. But in the US, most of these services could be covered depending on what insurance you chose. But sometimes it could have like add-on fees that you don't know, or fees that are not covered by your insurance fully. And also the ERs or emergency departments are open basically 24/7. So Sweden has one of the best healthcare systems in the world. They're ranked 23 in the world by the World Health Organization. Although it may take up to 90 days to receive said treatment, so like to see a specialist or to receive the surgery that you need. Although in the United States, we basically are the opposite. We're ranked probably last, and we have one of the worst healthcare systems when it comes to like the expense and mortality rate. You can and will get the service that you need when you basically need it. Although it could be extremely expensive depending on if you have insurance and what type of insurance you have.